Now, for the next drug before us, which we'll talk about, its pharmacology, is para-aminosalicylic acid. So, pharmacology of para-aminosalicylic acid. Okay. So the drug we said that is a bacteriostatic agent. When they say something is a bacteriostatic agent, it can pause the activities of the bacteria. Okay, so it actually inhibits folic acid synthesis in Mycobacterium tuberculosis. It acts as a structural analog of para-aminobenzoic acid, that's PABA. Okay, so to compete for what? Pteridine synthetase. Okay, so this will now disrupt how folate should have been formed. So to kind of like pause bacterial growth. Okay, so it interferes with mycobactin synthesis and is very important, okay, for the cell wall of the mycobacterium to be, formed. So it's mostly used in what? Treating tuberculosis. Okay, so it's primarily used in treating what? Multi-drug resistant tuberculosis. Okay, and also extensive drug resistant tuberculosis. So historically it was part of the first effective combination therapies for tuberculosis, right? So before, they usually used to combine it with streptomycin and isoniazid. So occasionally it's used as a second line, okay, in treating other inflammatory drugs like ulcerative colitis and also Crohn's disease. So it's well absorbed. Distribution goes into a lot of tissues. Metabolism mainly via the liver. Okay, excretion is through the kidneys. Half-life 0.5 to about 1 hour. So it can cause nausea, vomiting, epigastric pain, anorexia, can cause rashes, can cause fever, can cause malaise. So can interfere with vitamin B12, okay, leading to the malabsorption. Okay, so all of these are just rare stuff, you understand, but we'll just study them. So by and large, that's it for para-aminosalicylic acid.